What's the difference between a cyst and a lipoma? So the first thing I would say is that if you've got a lump underneath your skin, it could be a cyst and it could be a lipoma, but I wouldn't worry too much really about it because it kind of doesn't matter from your point of view. They're both benign and they're nothing particularly to worry about, and they can both be removed. The job is not to decide whether it's a cyst or a lipoma, so I wouldn't get into it too much. And the treatment is kind of similar in terms of the fact that it's surgery, so you sort of cut it out. The difference from a medical point of view, if you're looking for someone who's got a lump underneath your skin and you're thinking, is it a cyst or is it a lipoma? A cyst is a skin lesion. So a cyst is attached to the skin. There's often, not always, but often a thing called a punctum, a little hole that sort of the attachment to the skin where stuff can come out of. It's kind of within the skin, so it moves with the skin. A lipoma is subcutaneous, so a lipoma is underneath the skin, so you should be able to move the skin over the top of a lipoma, whereas you can't with a cyst. A cyst is sort of part of the skin. Lipomas can occur at any depth, so you can get lipomas deep. Cysts are always just right underneath the skin, but well, at least skin cysts are. You can get other types of cysts, but let's not complicate things. We're presuming you're asking about skin cysts here. So yeah, they're right underneath the skin. Lipomas can occur deep. Therefore, we will often ask for a scan with lipoma because sometimes they can be underneath the muscle and they can be quite deep. Now, when they are deep, they're less likely to be problematic. So if you can feel it, if it's a nuisance, especially if you can see it, it's unlikely to be too deep. The deeper ones you tend to not be able to see and feel, therefore they tend to be less of a problem. So you might be more inclined to leave it. So that's kind of works out quite well. But if you did want it removed, especially if it's large, we would often ask you for a scan just to see how deep it is, because they can be within the muscle, they can be deep to the muscle, which can make it a little bit more difficult to remove them if it's going to be done under local anaesthetic. When removing them, a lipoma's, I guess, a little bit easier to remove because it's a fatty lump, whereas a cyst, it has got like a wall to it, and you have to try and keep the wall intact. You're trying to keep all of that wall intact when you remove a cyst. So you have got to be a bit more careful when you're removing a cyst, because if you leave some of the wall behind, it can come back again. So you've got to be a little bit careful dissecting out that wall, and it is a little bit more easier when it's not been infected or meddled with. That's why it's good not to meddle with it. So talking earlier about meddling with cysts and popping them and things, you can't really pop a lipoma, so that's not really a thing. As I say, it's a fatty lump deep to the skin, but a cyst has communication with the skin, so you could pop it. The other thing is that cysts can get infected, they can get bigger, they can swell up, they can discharge, and you can get an abscess. So you can get problems with cysts, which you tend not to get with lipomas. You don't get infection or swelling up or these sorts of symptoms with lipomas. So that might give you an idea between whether it's a cyst or a lipoma. But as I say, if you've got a lump underneath your skin, I wouldn't lose too much sleep or try and research too much into it, whether it's a cyst or a lipoma, because if you want it removed, just get in touch and we'll have a look. And sometimes I'm not sure. Sometimes I'm not sure if it's a cyst or a lipoma, because it can be difficult to tell if the skin's moving over it or not. And you're not sure. It might be quite a superficial lipoma, which is right underneath the skin, and you think, but as I say, it's slightly academic, because when we cut it out, you can tell, but you cut them out kind of just the same. As I say, you need to be a bit more careful with the cyst than you would with the lipoma, but still, nevertheless, removing them is the treatment, and you try and remove the whole thing out. So you still have to make an incision about the size of the lesion, whether it is a cyst.
Thank you for watching the video. If you have anything that you would like me to have a look at and give you an opinion on, please send us a message on WhatsApp. The number is 07794 739 606. Be great to hear from you.